appreciate the wide variety of private businesses and other types of organizations that, while not having sponsored child care programs before, have really come together thinking creatively about what their employees and their communities need and are willing to contribute to innovative solutions. In developing the Hub program, careful thought is being given to establishing a system that helps with the immediate child care needs for school-age children on remote learning days without harming the existence of the network we have in place right now for early childhood, after school, and youth serving organizations in this state. Wherever we can, we will continue to build upon the investments the state has made in Vermont's child care system throughout this COVID pandemic. The end goal is to have child care systems in Vermont for infant and toddlers, as well as school-age children, that are stronger and more accessible. Just to provide an update, since last Friday, over 160 submissions have been put forward to either become a hub, provide space, or enrichment activities. On last Friday, we highlighted areas of the state where we are concerned, where we do not have enough capacity to meet the need. We are happy to report that the community response has been overwhelmingly positive, and additional conversations with our partners at Vermont After School have either already happened or are scheduled to take place in the coming days in those areas. We are now up to 12 potential hub sites that have been identified. The hubs can be seen here on the map, represented by black dots. The map developed by Vermont After School has the reopening schedule of every school serving children in grades K through 6. The shading indicates that reopening plans for that area. You will note that green means school is in person 5 days a week. Yellow is hybrid of in-person and remote learning. And the orange areas are remote learning. Gray areas indicate districts which the approach varies by school. The hubs are in 8 counties so far, the 12 potential hubs that I just mentioned. Addison, 3, Chittenden, 3, Franklin, 1, Lamoille, 1, Rutland, 1, Washington, 1, Windham, 1, and Windsor, 1. Combine these hub sites combined could provide approximately 2,300 child care slots, or the capacity to serve 4,600 children. We can serve approximately over 4,000 children because the sites identified so far are all in schools that have split schedules for attendance. Also, I just want to make you aware there are an additional 20 sites currently finishing data gathering conversations with Vermont After School that will be then elevated to the DCF CDD for final vetting. Those are represented in the blue dots on this map. Just to give you some idea, some of the activity that's happening out there, Essex Junction Recreations and Park is a hub site. They will serve 8 schools. They anticipate having 700 child care slots available and have already filled those slots. We highlight this both to show that there is great need that this provider has filled, and also to acknowledge that there is likely additional capacity needed to support all Vermonters who need this care. We continue to work to identify additional partners that could also support a program in that region. Mount Abraham Union School District Expanding Learning Program in Addison County will be serving 5 schools. They have an estimated 240 slots with openings ready to take additional children. They have just located a site for their Wednesday program when all schools are closed, and will have capacity for 100 children on that day. So the first 12 hub sites are working through their final stages with DCF this week. An additional 20 sites have applications actively in progress with the expectation that they will move forward by Friday. Approximately 40 more potential sites are under review. As for whether we will meet the goal of meeting the 7,000 slots, Vermont After School, along with DCF, has done a great job so far in a remarkable short amount of time. As I mentioned before, we're working together diligently and quickly to build as much capacity as possible in the time remaining. But I want to be realistic here, and I've said this a couple of times at this press conference since we've talked about this program. It may be that some sites come online after September 8th, but right now we're focused on building out the system as much as we can and working diligently to do that. It's important to keep in mind that we are dealing with a fluid situation. There are some schools that may move more quickly to in-person days, and there is always the possibility that we will need to decrease in-person learning over the school year if an outbreak occurs and the incidence of infection increases. The hubs are responsible for connecting children to their education. The educational services will be delivered by the school system. Hub sites must have access to Wi-Fi and will support children connecting to their classes. This is in addition to providing children a safe, enriching environment to spend their day on remote learning days. Conversations with the Agency of Education around access to food have happened this week, and a clear communication tool is being developed to share with hub sites so they know who to contact with questions. I just wanted to give you an update. There's been a lot going on with these hub sites, and as you can see throughout this map, a lot more will be forthcoming in the next few days. With that, and give an update on education and the progress there, I'll turn it over to Secretary Dan French.
Thank you, Secretary Smith. Good morning. I thought I would begin my update by addressing some of the data questions that have come up in the last few weeks. We are working with our partners at the Health Department to design the data reporting for if and when we have COVID-19 cases in schools. We are seeking to design an approach that strikes a balance between student and staff privacy with the needs of parents and a larger community to understand the public health trends. I thought I would share our initial work on organizing these data. Student health information is part of a student's educational record, so it is protected by FERPA, or the Family Educational Rights and Privacy Act. Staff data are protected by HIPAA. To address these privacy concerns, we are thinking of reporting the total positive number of cases in a school, with the number of student and staff cases combined. This means we would not report student cases separately from staff cases, and would not report student cases by grade level or class. Even with this level of protection, we have the issue of very small schools in Vermont. So our initial thinking is we would not report data on schools that have a combined student and staff population of fewer than 25 people. 25 is a number we arrived at after reviewing the size of our smallest schools and applying our best professional judgment relative to privacy restrictions and our current data practices. This means we will probably not be reporting data for about 15 of our schools. We believe a consistent approach to using these data at the state level will help schools with communicating with their families and their communities and can replace the need for districts to do this on their own. I think school level data will also be useful for highlighting our common purpose as Vermonters in supporting our students. By working together, we can ensure the safety of our students and school staff. When we look at our data relative to other states, it is clear we've been very successful, but we must continue to be vigilant to ensure our success in the future. Until we have a vaccine, we will likely have COVID-19 cases in our communities, which means we expect COVID-19 cases in our schools. We can minimize the likelihood of the disease entering our schools, however, if every Vermonter does his or her part in following the guidance from the Health Department. Our goal is not just to reopen our schools, but to keep them open and to provide learning opportunities equal to, if not better than, those provided before the emergency started. This will require everyone to work together. To monitor our progress on learning opportunities, we will be gathering data on school reopening plans and how they change over time. Commissioner Pieciak gave a preview of these data last week by sharing a map of initial school reopening plans from around the state. When we announced our approach to hybrid learning back in July, I indicated we would be collecting monthly data pertaining to the patterns of student opportunity that were emerging as part of districts having flexibility in designing their own plans. The data we used in the demo last week were gathered manually by analyzing these initial reopening plans. We are using this initial information in the map to design a more automated process for gathering and visualizing these data. We intend to launch this new data collection in late September, or after we make the shift to step 3, which we expect to make around the same time frame if conditions remain positive. The purpose of this data collection would be to monitor patterns of student educational opportunity. We think it is important to be able to understand how these patterns change over time, including how many students are involved in in-person instruction, remote learning, hybrid learning, and what the student grade levels are. As we approach the start of the new school year, I would like to thank all the administrators, teachers, and their school staff for their hard work in making the necessary preparations. When I talk with educators around the state, I consistently hear from them that this is some of the hardest work they've ever done. To highlight some of this work, I would like to share some of the preparations of the River Valley Technical Center in Springfield. River Valley Technical Center is its own school district, which is a fairly unique structure for a tech center in Vermont. River Valley Technical Center is hosted on the site of Springfield High School. Also located on the site is the Vermont Virtual Learning Cooperative, which has done phenomenal work during the pandemic in rolling out a statewide online learning platform. In addition to serving the students at Springfield High School, River Valley also serves students from a larger region, including students from Green Mountain Union High School in Chester, Bells Falls High School, and Fall Mountain High School at Langdon, New Hampshire. The reopening plans for the Tech Center, therefore, had to be coordinated with all these districts, including a district from another state. The center began for its reopening by forming a committee that included teachers from its various programs, the lead negotiator of its teachers union, and its cooperative education coordinator. This core committee was augmented as necessary when it had to address specific issues such as special education and student support services. The center's planning team considered the state's health guidance as a blueprint, walked through each of its elements, and applied them to the unique circumstances of the center. The center's plan addresses many specific logistical considerations, such as how students and where and how they will be dropped off and enter the center, since students are coming from many different sending high schools, and the center itself operates separate morning and afternoon programs. Due to the hands-on nature of many of its programs, the center decided to implement a schedule of in-person learning for 4 days a week. For 1 day a week, all students will be engaged in remote learning. And for the first semester, some of its programs will be completely online, including its information technology and business and financial services programs. This complex schedule had to be coordinated with every sending high school. To do this, the center's leadership team held monthly meetings with all the principals throughout the summer to coordinate the schedules and transportation routes. Their success in collaborating demonstrates how valued these technical center programs are to both students and their communities. As one high school principal remarked, "My kids won't come to school if CT is not open." The support for the center is also evidenced by the degree to which parent groups self-organized on social media to provide transportation and carpooling options for students. It has been observed that perhaps one of the more lasting impacts of this emergency on Vermont's educational system will be a stronger conceptualization of how to use remote learning technologies. Being co-located with Vermont Virtual has certainly given River Valley some advantages in that regard, but it's interesting to note how this emergency has expanded the center's use of online learning in new, innovative ways. This innovation was stimulated by a strong commitment on the part of the faculty that they needed to take advantage of every opportunity to work in person with their students. As one instructor said, "The first day will be like, 'Hi, good to see you again. Now pick up your tool bags and let's get to work.'" To maximize the time for in-person instruction, the center purchased new digital cameras that operate in 3 dimensions and are motion sensitive. Instructors are using these cameras to record introductory equipment and procedure demonstrations. These video demonstrations are then uploaded to their online teaching platforms so students can access them 24/7. I think the staff of River Valley Technical Center would agree that planning for the reopening of school this year has been some of the hardest work they've ever done, but it's clear that their planning has paid off. Their reopening plan demonstrates a confidence in working together and problem solving that is representative of a high-functioning organization. Like so many of our educators, they leverage their expertise and use their best professional judgment to do what is best for their students and their communities. It is clear to me in reading their plan that not only are they ready to reopen their school, but they are also well prepared as a team to navigate the new challenges that this semester will inevitably bring. I would like to thank all Vermont educators and school staff who, like the staff of River Valley Technical Center, have worked so hard this summer to make preparations for reopening our schools. I think this work has been incredibly challenging because in many ways, we have asked our schools to do things they were never designed to do. Whether it's shifting immediately to teaching all students online, providing childcare, using school buses to deliver meals, or holding high school graduations in cars. It is also challenging because as educators, we cherish our routines and traditions, and to a certain extent, some of those routines and traditions have been disrupted. As we prepare to reopen our schools, however, we have the opportunity to create new routines and to reestablish a continuity of learning in the lives of our students so they can pursue their plans through education. Although this pandemic has been disruptive of our traditional school routines, we cannot let it be disruptive to the aspirations of our students. So, thank you again for all the school personnel who have worked so hard this last 6 months in support of our students. I expect the reopening of our schools next week will go very well. Thanks to your dedicated service to our schools and our communities. I'll now turn it over to Dr. Levine.
Thank you, Secretary French. Last week, Vermont had 8 new cases per 100,000 population. The national number was 88 per 100,000. We remained lowest in that as well as in percent positivity rate. There are so many things going on the national scene and on the medical scene with regard to COVID. I suspect people in the public are having difficulty just keeping up with the onslaught. Being the cleanup hitter this morning and looking at the time, I'm going to restrict my remarks to what's going on here in Vermont right now, but I'll anticipate there'll be plenty of questions in the Q&A with the media. So let me talk about the Rutland County Killington outbreak. As we announced in a news release yesterday, the health department is investigating an outbreak of COVID-19 cases associated with people who attended a private party at the Summit Lodge in Killington on August 19th. At the outset, I want to first thank the management at the lodge, who've been eminently cooperative, for following the state's guidance to protect their guests and employees, and for their assistance and support of our efforts to contain this outbreak. To date, we have identified 14 cases among people who were at the party and among their close contacts, which means the virus has spread to people who were not at the party. I understand this news potentially could be yet another worry for people in the community, but as I've said before, the efforts to contain outbreaks, whether we're talking measles, Ebola, COVID-19, this is what we do. We have systems in place to address public health situations, even ones that take a long time, like pandemics. And like we do for all outbreaks, clusters, and situations of cases in Vermont, our experts here at the Health Department are working nearly around the clock on this. Keys to our success are the actions that Vermonters take every day to keep yourselves and others safe. You know the drill. Masking up and keeping a 6-foot distance from others, washing hands often and well, staying home when you're ill. There are serious reasons why we say this over and over. These seemingly routine actions have an important cumulative effect. They are a significant reason why Vermont is doing so much better than many other states and countries. So by taking these actions every single day, you reduce the chance you're exposed to the virus and you help protect others, especially people who are at risk of serious complications or worse. The Health Department's investigation began last week as part of our standard outreach to give guidance for isolation or quarantine to people who've tested positive. Our expert contact tracing team has been working to reach the more than 40 people who were at the party. Contact tracing is key to our ability to contain outbreaks, and I'll speak a little more about that in a few minutes. We appreciate the cooperation of those who've responded to our contact tracing team thus far, and we urge anyone who's contacted to please also respond to calls from the department. If you attended the August 19th event but have not been in touch with the Health Department, please call 802-863-7240 to make sure you have the information you need to protect yourself and others. Because it's possible to spread the virus without developing symptoms, people who attended the event should also take steps to limit any possible exposure to others. If you attended the party, or if you are a close contact of someone who attended, monitor yourself for symptoms of COVID-19. If you have even mild symptoms, contact your healthcare provider to be tested. Speaking of testing, pop-up testing will be held in Rutland City tomorrow from 9 a.m. to 3 p.m. at our local health office in the Asa Bloomer building. Registration is required. To register, go to healthvermont.gov/COVID19/testing. We are also arranging additional testing opportunities the remainder of the week in the area. I want to return to the topic of contact tracing for a moment. After a half year of experiencing this pandemic, contact tracing is a term everyone should be very familiar with. The concept may seem quite simple, reaching out to a confirmed case of COVID-19 and then their confirmed contacts, so they know what to do, how to prevent further spread of the virus, and have the information they need to recover and stay healthy. But contact tracing is not just a notification system. It is work that takes care, empathy, patience, knowledge, and expertise, both medical and in helping people handle news they generally don't want to hear. If you test positive for COVID-19, contact tracers will ask you questions about your symptoms and activities. They use your answers to determine when you were infectious and then who your close contacts were during that time, anyone you were within 6 feet of for at least 15 minutes. Contact tracers then reach out to these close contacts who may be at a higher risk of getting COVID-19 themselves. They give health guidance, answer questions, and provide support to people who may be stressed out or overwhelmed. Not an easy job, but I'm proud to say we're doing it well. Here in Vermont, 92% of cases are interviewed within 24 hours. This is a very high percentage, probably one of the highest in the nation. It does stand in stark contrast to news we've heard of other states and cities that have struggled to reach the people they need to, which means virus can and does continue to spread in their communities. While I want to give a lot of credit to our team for their time, expertise, and truly impressive commitment, I must give equal credit to the people of Vermont, who understand the importance of answering the phone when we call, talking to us honestly, and doing everything they can to stop the virus in its tracks. This is public health. As a physician, I want everyone listening or reading my remarks to truly know there's no shame in being exposed or contracting the virus. If you made a choice to not wear a mask one day or attended a party where people were not taking precautions, then all I can ask is that you learn from that and make different choices the next time around. And don't let that keep you from working with us to contain the spread of the virus. We've run into a very few people who are uncooperative. I understand we all have different reasons for the choices we make. I may disagree, but I don't judge them. If you are contacted by a member of my team, I ask that you check your feelings at the door. When it comes to protecting the public health of Vermonters, we all have a responsibility to do our part, even if it's as simple as picking up the phone when we call. Vermont is about knowing we can count on each other when it matters the most. 9 years ago, we were Vermont strong when we worked together, neighbor helping neighbor, to recover from Tropical Storm Irene. And despite the sense that COVID-19 is the new normal, it really is not. It's a long-term but finite public health emergency, one that we can end all the sooner if we work together again, each of us doing our part, even when it's inconvenient. So I ask all Vermonters to keep up the good work, and thank you for doing so. And if you learn of a possible exposure or a case at your place of business, contact the health department and encourage any customer who tests positive to get in touch with us as well. All this will help ensure we can do the essential and proven work to containing this virus. I'll turn it back to the governor now.